Here at Hotel Dieu Grace Healthcare, all of the staff have been, thank you, perfect, very committed to our strategic drivers. But again, it's changed. And recently, we've reviewed our strategic plan. And the difference that I felt meeting with the teams this time, there's still one more to meet next week, has been we've gone from what's going on, who are we, to wow, let's think of a new idea. Maybe we can do this. Now we know a little bit more about who we are. I have had the luxury and the pleasure of serving on as manager of a number of outpatient programs, and it's not random that in parallel we're all doing this. So, as one Ahmad said this week, we've drank the Janus juice this time. In the video we're seeing this week and next, there's an excitement about where we're going and how we contribute to the community. It's not just about the paycheck anymore. We really feel like we have the tools to do this. So that's sort of what today is about. And so we're talking about one program. The co-authors of Dr. Cortese, Nicole Dubé, Sue Olsant, Amy Goulet, and Darusha Moodley are in the wellness program for extended psychosis. But any of these programs in the outpatient mental health clinics are at the same level. And I would argue at the end of this, we're all going to be pretty excited, and we all are already, about these sorts of initiatives and in parallel, having them grow. So I'm going to try this and see if it works. Okay. So we're going to talk about this idea of student as facilitator guide in a peer review process for the wellness program for extended psychosis. This program serves individuals in our local community who have psychoses and psychotic disorders who are chronic and lifelong, mostly adults. So what is involved with a lot of work are our 3 nurses and our team of psychiatrists. First and foremost, and important to other tasks, but looking at managing medications, the right medications for many individuals with psychosis, mostly schizophrenia. And the program really addresses a time in someone's life when they are post-acute. And I don't know what everyone else's definition of post-acute is, but I know in our outpatient programs, it is a hair away from being in the hospital. That is who we see at Hotel Dieu Grace Healthcare. And the community, we are told many times, is we're comfortable with that. We're looking at independent living, but for those individuals who still feel very acute in their illnesses. So you're talking about people who are in crisis and who do go through crises. And that's sort of the population we're serving, and the idea that today is being proposed is how do we look at a student-facilitated peer support system for these individuals' family members? Okay. Sorry, I didn't. And what we do know from research is that, and this is clinically we see it, and you all probably see it, it's at the times of crisis that we really see a lot of the family members in adult mental health. We were having a discussion over the lunch hour with some colleagues about that. When child mental health, there's a family member there or a caregiver somewhere. With adult mental health, we're trying to balance that fine line between making a go of it on your own independently, yet with an illness that inherently will involve your family members. And so, if you remember from the slide from the presenter earlier today, our keynote speaker, there was that young boy who'd moved 22 times, right? Well, I'm sure in between, that young boy wasn't at the house eating dinner every day, right? So it's a lot of family there for crisis, family away, maybe burned out, or otherwise taking a step back to try to foster in between. So when looking at the support, so again, 2.5 years ago to today, figuring out who we are, looking at our patients, our people, our community, we have a pretty good idea of what that is. But what about the family? Where does it fit in? And how can they help? All we know right now is we get the desperate calls, first thing in the morning from a staff member. Those are the crisis calls we get, family members. I can't talk to you. You can talk. I know you can't talk to me, but I can talk to you. Police have been called. You have never heard from me, but this is what happened on the weekend, right? And so we need to do better, right? We know we need to do better with that in the programs, at least the ones that I've been involved with, and we'll all admit that. And what we see in this wellness program for extended psychosis is that family members begin to burn out. We are, in this program, we have for years engaged families to fill out a caregiver burden clinical tool so that we can sort of gauge that and do treatment programming. And within our program reviews, we see as various symptoms increase in severity, the caregiver burden and the demands on the caregiver also increases. And we've looked at correlations, and we all know that. And it's not all symptoms, it's certain symptoms. It's things like avolition, not being able to get things done, not being productive, are more distressing to family members than to their loved ones with the illnesses, right? So how can we, now knowing that families are the sort of life course primary caregivers, so different doctors, different nurses, different social workers, different psychologists, but it's the family members who actually play that life course role, right? And so how can we invest in our patients and their future by investing in families? We know that the role is important. So we started off with education. We heard from family members that they didn't even know about our program, and we heard at tragic times, right? We heard at difficult times, and so we learned and we listened. We heard that they didn't know how to contact us was the number one thing, that they knew things we didn't know, and their loved ones knew, and it was alluded to again in the talks earlier today, both of them, that people can give and pull consents, right, as adults, and it is a gift and a flaw, both in the system, right? We all know that. So we know that that's there. What have we done so far in this program? Well, so we started off with, what about the internet, right? Families on the internet. So we did a lot of research, we looked at it, we asked our family members, we asked our patients, what is it that you would like to know? And from the families in particular, again, we're focusing on the families because we didn't have time to even before. We just had this immediate need to look at who our patients are. We gave information. This is just a little sampling of what's on the internet, but it's basically how can you help in your loved one's care, right? But it doesn't feel enough, right? You sit with the team and we sit together, we know it's there. Are our family members really going on the internet? Maybe. It still doesn't feel like it's enough, right? We know it's not enough so they have the crisis line, that's fantastic. Are they accessing it? Is it education? Even if they all went on the internet and saw it, is that enough? And that's where, in mental health, we're always thinking brain, right? And we're thinking behavioral patterns. And so we're still fostering and facilitating this system where we're educating families, we're educating and working with patients. The family member is going to be the lifelong primary giver, but there's no behavioral pathway there to develop and cultivate that relationship, right? We're not facilitating that still. Maybe we're being helpful for crises and things like that, but there's a brain that has to develop a pathway. We know that, and we know it has to be through practice and step by step. So how are we doing that? This is good, but it's not enough. And so we looked for other educational resources and went on a blitz. great education out there. CAMH, CMHA, Schizophrenia Society of Canada, all of those organizations. I mean, there is no need for us to reinvent the wheel. If you want a cognitive behavioral therapy for individuals with schizophrenia, there's great programming out there and anxiety. But again, it still felt like it wasn't enough. And I know that I see a lot of my team members in our other outpatient programs saying, yeah, like we're doing the education piece. We provide pamphlets, brochures, websites. Education, is it just us? Are we not accessing it? Is education enough? And so education is not enough, not enough. It's a great start, and I don't think without it we can do anything very much, but so we think of, what does this remind me of? And of course I'm going to throw in something about my son in the presentation, if you know me. He has a coach who's amazing. He is the only person in his sport, the coach, who served on both the Canadian and American Olympic teams. And his favorite phrase, which is really hard to hear when someone says that to your child, is mediocre is not good enough, right? He says that all the time, and it's hard for me to hear as a mom, but it's true. Education alone, information on the website, I know our teams, I know we feel it's not enough. It's not just me, it's the teams. We feel it. So what can we do? Well, we can take ideas like this conference and say, hey, wait a minute. As we were thinking of the idea, let's actually think of the idea. So the proposed project that we're discussing, and it could be in this, but I have a feeling a number of the other programs will join in, is to cultivate and strengthen the relationships between our patients and their families, when possible and when it's appropriate, right? Sorry. The challenges, confidentiality, power differentials. When I have a nurse on the WPET team come and talk to a family member in a group, they all think that they're talking about their loved one. And at the end, as you know, a lot of family members will come up and want to know about their loved one. How do we overcome that? How scary is it and frightening to think that the nurse that you've just talked to for 45 minutes is giving a presentation, right? It's very frightening. So that's one issue. And so how do we follow the principles that, again, one of our speakers was sort of reviewing today about ethics? How do we maintain justice? How do we maintain those standards, right? Certainly research has some standards that, different than clinical standards, I'm sure, some overlap, but at least there's a process, right? So the idea of a student, we've had a great number of students come through the program in clinical roles, but what about the student as a guide or facilitator? There's a lot of research that indicates that peer-supported groups for schizophrenia and severe chronic mental illness are difficult because they're so difficult to understand, the illnesses themselves. So how do we get the right information out to a peer support structure of family members, right? How do we get that? And so we look at the Schizophrenia Society of Canada, for example. They have a Strengthening Families Together curriculum. Super fantastic. Super if you look at the CDs and extra resources. But how do we present that to our family members? How do we strengthen the relationship? So again, that's a part of it. So curriculum we're good with. It's the process and it's the who and how. There's just another example through of research about guided peer facilitated groups. So we know that there are problems, again, confidentiality, power differentials. So what about students? The power differential's not there. The education is there. The student isn't coming in as a clinician and running the group. They're a guide, and not even as strong as a facilitator. They're there to facilitate communication. And so, it just went ahead, sorry. I think it just clicked on the internet or a link. This is how I magically download something really strange from somewhere, and my family wonders, how did I ever do that? You're all witnessing it. I wish they were here. They'd be jumping up and down going, that's how it happened. The wild clicker. So we are going to get there. All right. So the idea is we know we would like a student to take information about our loved ones in terms of their ecology. This is Bronfenbrenner's model. There are so many models out there, different models this morning. The idea is you're an individual in the middle, you have a family, you have a system, you have ideological beliefs. In Windsor, we have the economy, we have the bus pass changing. The bus pass fees going up was an enormous impact on our WPEP program. Coming for injections, the injection clinic changing location, right? All of those things are important. Families don't know. Families, we can't sort of make it a, let's give you the inside scoop, but we have to take into account our community. So how do we take those great curricula that the other organizations have invented and did a much better job than we could given our resources, and how do we incorporate it into our community? It's just like with any research. How do you look at a big research study and say, why is this relevant to our people, right? So that's the idea. The student will have the opportunity to do that. Student will meet once a week or on a schedule, we're not sure yet, with the clinical staff, and then meet with the families, right, as peer support. Hopefully, with the structure of the university, the student will actually make this, we can work together to develop this into a meaningful research study. There are other communities like us with similar demographics, similar ethnic diversity, similar economic needs. How do we do that, right? And how do we overcome that our nurses all know the clients and the families, and it's awfully frightening for many to think that they'll be making a presentation. And it's very difficult not to stay after and to say, well, I wasn't really hinting, at your loved one. How do we keep that professional boundary there? We know that at our Christmas party and our party and our picnic in the summer, almost every single family attends. If there's one not there, there's something wrong. Yet we do not have permission to speak with most of the families, right? So we need to really get creative and think how we're going to do this. We need to do it in a way that's ethical. We need to do it in a way that doesn't invite a family when they're not allowed to be invited. We have to get creative, and that's where we're at right now. The good news is we have sort of moved on from what's going on and who are we to how can we change and evolve and innovate. So that's the very simple idea today. Thank you.